Everyone, thanks so much for joining. Very pleased to have Dr. Gino Lagarde from Region 9 or the North Shore area with me. Um, Perspectives of her area once I'm done, giving some top level data and information. I do want to open up by just recognizing a study that the mental health toll that the pandemic has had on public health workers across the country. They noted, and this has been talked about by Dr. Walensky, the CDC director, quite a bit in the past week and a half. Over half of public health workers in the country have experienced either depression, anxiety, or other mental health complications related to their work the past year. I say this by way of recognizing my team in the Office of Public Health, and also thanking you for the coverage that you've given, which I think has done a good job of honoring the work that they do. It's been hard and their family. Thanks for giving them proper coverage throughout this pandemic. Let me move on now. The news I have to share is not ideal, and I wish I had better news to share with you. But after a few months of relatively quiet in our COVID numbers, really since the vaccine campaign has gotten into full gear, we are now unfortunately seeing increases. I'll tell you, and we'll talk more about this in a little bit, that there's very little.
Dr. Cantor, we lost you for a second. It's a little bit hard to hear you.
I might have, let me.
Yeah.
It's better.
I think that's better.
Okay, thanks. If you guys, thanks Melinda for flagging that. If I cut off again, please let me know. The internet's been in and out a little bit. Without a doubt, we are now seeing increases. And I think it's enough to say it's a trend. I think clearly in rebound. And the way we know that is because we see that play out across not just one measure, but really every measure that we track. It really is the first time since the vaccine campaign got going in earnest that we're seeing increases. Not just us, other states are seeing them as well. Nationally, cases have gone up too, but it is concerning. I think we're just in the beginning of it, and it's difficult to know where we are now, how severe of an increase this will be. We've had 3 severe spikes to date in Louisiana. The first one was the first one that we had back in March, April 2020. And then we had the summer surge in July and August, and then we had a very large Christmas and New Year's surge. So right now we're in the very beginning of increases. It's difficult to know how bad it's going to get, but it does have us concerned. So let me give you a sense of what I'm seeing from my perspective. We have increases in incidence, which is the number of new cases of COVID diagnosed each new day. It's now been increasing statewide for the past 18 days and increasing in 7 of 9 regions throughout the state. Percent positivity is increasing. It's now at 4%. 4% of all COVID tests being done over the past week are positive. That's up from 3.1% the week prior. And it's also increasing in 7 of 9 regions throughout the state. I think most troubling to me is the increase in hospitalizations, because when you see increases in hospitalizations, it's irrespective of how much testing is or is not being done. We've added about 100 hospitalized COVID patients throughout the state in the past 2 weeks, We're now at 351 hospitalized COVID patients throughout the state, of which 33 are on mechanical ventilators and in very severe condition. Those are not good measures to look at. It's clear right now that COVID is increasing throughout the state, and the risk of being exposed to COVID when one goes about their day-to-day activities is higher now than it was a couple weeks ago. There is also very little doubt that this is because of the Delta variant. So I'll take a step back and kind of recap what we know to date on the Delta variant. It is more transmissible than the prior variants. perhaps about 60% more transmissible, but that number is relatively imprecise. It is likely more virulent, meaning if you get COVID with the Delta variant, you're more likely to get sick or sicker than you would have been if it was the other variants. That's what we learned from the experience in the UK a few weeks ago. It also seems to have an ability to infect younger individuals at a higher rate than the previous variants did. And we are seeing the average age of hospitalized patients go down a little bit, and we're seeing more younger people get sick. It still is, as a raw number, relatively low. And the previous idiom for COVID, which is you're more at risk the older you are, still holds. But we're seeing a trend of younger people get sick, and that's concerning. The issue in a very broad sense with these variants is they're to be expected with any virus like this. Every time the virus spreads from one person to another, it goes through these random mutations. That's natural. And 99.9% of the time, these random mutations are irrelevant and insignificant, don't change any important dynamics about the virus. Every now and then they do. And that's how a variant of concern arises. It's on some level chance or dumb luck, but when more COVID is out there and more COVID is being spread, then the chance that one of these mutations is going to give rise to a variant of concern increases. And that's where we stand now with Delta. Delta for the past month has been doubling in numbers nationwide about every 2 to 3 weeks. And that's the place that we find ourselves now. So as of today, 52% of all new cases of COVID in the country are due to the Delta variant. That percentage is higher in our region of the country, where it's 59% of new cases of COVID are due to the Delta variant. Our region of the country includes us, Texas, Oklahoma, Arkansas, and New Mexico. So if one was to be exposed or contract COVID tomorrow, odds are more than likely that they will be exposed to the Delta variant. It is the dominant strand, both nationally and in Louisiana now, and it is almost certainly causing the increases in COVID that we're seeing right now. Now, the good news with the Delta variant is it remains a good match for the 3 vaccines that we have available to us. Pfizer, Moderna, and J&J are good matches for the Delta variant. There's no guarantee that for whatever variant comes in the future, that will be the case. No guarantee at all, but it is for the Delta variant, and that's proven right now in both in vitro or lab-based experiments, and also real-world experiments looking how people respond. So we feel good that the vaccine is a good match if someone chooses to get vaccinated. If they don't choose to get vaccinated, obviously it doesn't do any good. And I think what you're going to see across the country now as Delta continues to spread and is the dominant variant is localities that have lower vaccination rates are going to be vulnerable. The communities that have lower vaccination rates are going to have more cases, more increases. Unfortunately, that's where we find ourselves largely in Louisiana. In most communities across Louisiana, we have the added vulnerability of it being summertime down here. And what happens here in the summertime from a virus transmission perspective is similar to what happens up north in the winter, which is the weather drives people indoors, and that's a risk for transmission. So we have a lot of vulnerability right now, and I think we're going to continue to see cases go up. I don't know how high, I don't know for how long, and I hope that increases in cases will be connected to lower increases in hospitalizations and death than we would have seen otherwise. And the reason I'm optimistic about that to some degree is that I do think we've done a relatively good job of vaccinating elderly individuals in Louisiana, people with serious underlying conditions. And I hope that that protects us a little bit so that any increase we see in hospitalizations or death is less than it would have been otherwise. But I still think that we're vulnerable. And that's where we find ourselves right now. You talk about where we are with the vaccine campaign. It has certainly slowed, but it has not stopped, and that's important to know. 39% of all Louisianans have at least initiated the vaccine series. That's 1.8 million people. That's not herd immunity, but that's also not insignificant at all. 36% of Louisianans have completed the vaccine series and are fully vaccinated. Of adults 18 and over, 49% of Louisianans have initiated the vaccine series. And for individuals 65 and older, 80% of Louisianans have initiated. 76% of older Louisianans are now fully vaccinated. I think those numbers can stand to improve. I think they need to improve. And I do think that many communities in Louisiana are going to remain vulnerable until those numbers improve. We talk a little bit about breakthrough cases. I think as Delta spreads, we're going to be talking more about breakthrough cases. We track very closely when an individual contracts COVID despite already being fully vaccinated. And to remind folks, fully vaccinated means you're 14 days or more out from completing your series. We consider that to be a breakthrough case. And the thing is this, these vaccines are very, very effective. 94, 95%. Excellent coverage for any vaccine. I mean, you're lucky if any vaccine is that effective, but that's not 100%. And that's the thing that we try to explain to folks. 95 is great, but it's not absolute. And so one's risk, if you're fully vaccinated, of contracting COVID despite being fully vaccinated is directly related to two things. How good of an immune response did you have to the vaccine? And if you're older, or if you have an underlying condition that you may or may not know about, you might have had a less than robust immune response. And number two, how likely is it that you're going to come in contact with COVID, be exposed to COVID in your day-to-day life? And now that risk is increasing. It's higher now across Louisiana than it was a couple of weeks ago. So I do think we're going to see some more breakthrough cases. They remain rare. By the numbers, they remain rare, but there's still just as troubling. Someone's having a good time right now, I can tell you that. These breakthrough cases remain rare. So as it stands now, of everyone that has been fully vaccinated in Louisiana, 1,763 have tested positive for COVID despite being fully vaccinated. Overwhelming majority of those 1,700 individuals had either mild or asymptomatic infections. Of those 1,700 individuals, or 1,763 to be exact, 103 individuals have been hospitalized because of their breakthrough infection, or 0.006% of everyone who's fully vaccinated. And of those 1,763 individuals, 27 have died from their breakthrough infection of COVID, or 0.002% of everyone who is fully vaccinated in Louisiana. To illustrate that the vaccine's efficacy tends to go down a little bit as someone gets older in age because their immune system is a little bit weaker, the median age of serious breakthrough infections, and by serious, I mean either hospitalized or death, is 73 years old right now. There's a range that ranges from 28 to 97, but the median age is 73. When I see these breakthrough infections, the conclusion that I draw is if I myself am vaccinated, it is excellent protection for me. It's excellent protection for those around me too, because I'm also less likely to pass the virus on to somebody else, but not 100% protection. And the way that I can make it even more protective for me is to get those around me vaccinated. That's the bottom line here. We will continue to track these breakthrough infections. Right now, we are seeing no signs that there are troubles with the Delta variant in terms of breakthrough infections. We believe the vaccines remain a really good match for the variants we have, particularly the Delta variant, but we'll continue to track these very closely. Our team does a really good job tracking them, and we'll let you know if anything changes on that. Nationally, and this is a number that Dr. Fauci and Rochelle Walensky at the CDC have put out last week, 99% of everyone who died from COVID in the month of June was not fully vaccinated. That means a lot. Let me just close real quick and talk about the lottery. This is very exciting stuff. We have over 600,000 Louisianans who have at least initiated their vaccine series, have registered so far for the lottery. They do that at shotatamillion.com. The first drawing is next week, and the first deadline is tomorrow. So we're going to do 4 weekly drawings. The same schedule carries out. So tomorrow is the deadline for someone to initiate their vaccine series. They have to do it by tomorrow and then register online. The drawing will happen next Wednesday. The announcement of the winner will happen on Friday, and then that schedule will repeat essentially for 4 weeks. Anyone who gets at least 1 dose is eligible. Cash prizes if you're 18 and older, scholarship money if you're below 18 years of age. We have seen a little bit of a bump in vaccinations since we announced this. We're hoping to see more, hoping to add some excitement to it. And there really has never been more urgency than now because of what Delta is doing across the state. The vaccine hotline remains open. I'll give you the number one more time. And Allie, I might ask you to drop it in the text as well. 855-453-0774, 7 days a week until 8 p.m. every day. And it can connect people to vaccine locations. It can get people vaccine appointments. It can help arrange an in-home vaccine visit if someone is homebound, and it can answer questions. So with that, I'm going to pause. I'm going to ask Dr. Lagarde to share a few remarks, and then we'll all take it back over and we'll open it up to questions. Dr. Lagarde?
Yeah, thank you, Dr. Cantor. Hi, I'm Dr. Gina Lagarde. I'm the Regional Medical Director and Administrator for the Office of Public Health, Region 9. And that consists of the 5 North Shore parishes: St. Tammany Parish, Washington Parish, Tangipahoa Parish, St. Helena Parish, and Livingston Parish. We are seeing pretty much similar to what Dr. Cantor explained as to what's going on in the state. As of June 30th, our percent positivity has increased from a week ago being 4.4% to now 6%. We're also seeing an increase in cases, COVID cases, as well as an increase in hospitalizations over the last 14 days. I mean, the reason for that increase in cases and hospitalizations is multifactorial, as Dr. Cantor explained. You know, part of it is the Delta variant. The other, another factor is the lower vaccination rates. We were doing very well early on, but we have seen a slowdown in our vaccinations, as well as human behavior. It is summertime. We're gathering more with our family and friends. We're gathering in large crowds, and people are not wearing masks as well. And, you know, those changes coupled with the Delta variant and the low vaccination rates will lead to increased cases and increased hospitalizations. And we are seeing that on the North Shore. But I will tell you, I want to thank the over 200,000 North Shore residents who have initiated their vaccine, and the almost 200,000 North Shore residents who have completed their vaccination series. About 33% of those eligible on the North Shore have completed their vaccination series, and that's a two shots for Pfizer and Moderna, and the 1-shot series, the 1-shot J&J. You know, we continue to work towards ending this pandemic on the North Shore. We continue to offer testing, especially in our parish health units, as well as the surveillance. You know, one of the ways to help control the spread of COVID is early identification. And the way we do that is with testing. So we definitely encourage everyone who were either exposed or who are symptomatic to get tested. We have seen a drop off in our testing over the last couple of months, but with the cases increasing and more people becoming symptomatic, I'm sure we'll see an increase there. And we're also continuing to offer vaccinations. We offer vaccinations in our pharmacies, in a community, with the hospitals are vaccinating. We are offering in our primary care offices in the region, as well as our health units. And we are also continuing to host community vaccination events. With our Bring Back Louisiana campaign, we want to ensure that there's equitable access to vaccines. So we're also going into very small communities, and we're even vaccinating homebound residents. We want to make sure that those that want the vaccine have access to it. And we don't have public transportation or mass transportation on the North Shore. So we have to make sure that we're bringing the vaccines into the communities. But we want to make sure that as we bring the vaccines there, that people come to get vaccinated. The single most important thing to ending this pandemic is to be vaccinated. We are also vaccinating in the work sites. We are vaccinating in congregate settings like the jails, in our nursing homes, and about 80% of our residents have been fully vaccinated. So we're going to continue our efforts to offer the vaccinations in our communities, and we're also offering vaccinations in the schools. So we, I mean, it's going to take a village, basically, to ensure that we minimize the spread of this disease and to continue those preventive measures that we know, or mitigation measures that we know work. But one of the most important measures is to be vaccinated. I will tell you, though, I'm sitting in my car right now, I am a cancer survivor, and I went to my 3-year cancer visit today, and I looked around the room, and to say, you know, I got vaccinated for me, but I also got vaccinated for those who are vulnerable and cannot be vaccinated. So, you know, again, for any of the reasons that you may have concerns, please discuss that with your healthcare professionals, with your doctor, or with any of us in public health, so that we can address some of your concerns for vaccinations. But we will continue our efforts in the regions to end this pandemic. And back to you, Dr. Cantor.
Thanks so much, Dr. Lagarde. We're going to take a pause there, and I think start getting some of your questions answered. So I'm going to ask Kevin Litton from our comms team to kind of run us through questions and moderate a little bit. Kevin?
Did you want to start off, Emily, on correlations between vaccination rates and hospitalizations?
Sure. Yeah, I'm just wondering if you're seeing that relationship yet play out, places that are not vaccinated having more cases or hospitalizations, and vice versa.
I think it's a good and fair question, Emily. I think it might be a little bit too early. You know, at the extremes, I think you can see evidence of that. You know, for example, New Orleans, you know, right now has the highest vaccination rates in the state, and the lowest percent positivity amongst large areas. They're at 1.6% positivity this week. So I think there's no question in my mind that's because of the vaccination base they have there. To get more granular throughout the state, I think it's a little bit premature to try and do that. I'll also caution, you can't really look at hospital censuses in certain areas in parishes and make that conclusion, because hospitals very frequently will take patients in from elsewhere because that's where the capacity is. Cases you might, but then you get caught up a little bit with how much testing is being done. So I think at the extremes, like looking at New Orleans versus other cities, you can start to see that trend, but being more granular, I think we're probably a little bit too early to see that.
And Rosemary, I know you had a question for Dr. Lagarde. Did you want to go ahead?
Yeah, I had seen someone do an analysis of new hospitalizations in Region 9 versus the rest of the state, and said that they were far higher there. And just basic numbers I crunched today sort of said the same thing. So can you tell us, Dr. Lagarde, whether Region 9 is seeing the highest increase in hospitalizations? And my baby wants to know that too, please. Thank you.
As I stated, we are seeing an increase in hospitalizations. Again, we are seeing a slight increase in our cases as well. And also, just as Dr. Cantor said, when you look at the census in the hospital, you know, it's not uncommon that some of our hospitals will receive patients from other regions as well. So I cannot tell you that it is totally reflective of this large increase in infection rates, because I do not see that. And again, you know, it can fluctuate, but it is not only just being those residents. We don't just have residents that are from the North Shore in the hospital. So I can't really say that there's that strong correlation between a larger number of cases in our region as to the reason why we may have a larger number of hospitalizations.
I'll just ask this is a really quick one from at BR Proud. Are we on track for another surge from what you're seeing in the data, Dr. Cantor?
Yeah, I think that's fair to say. I mean, on track for a surge is, you know, it's tough to know you're in a surge until you're a little bit farther in it. You know, it's easier to say you're in a surge in retrospect. Cases are going up, you know. I mean, if they continue to go up for another couple of weeks, that's a major surge. If they go up for another week and then peak and go down, then I don't know if I would call that a surge or not. But we're definitely seeing increases now. So I think we're at fair liability that this is the beginning of a surge. I think you just probably need a little bit more time to be able to conclusively say that.
Shay, did you want to go ahead? If you could just keep it short, I'd like to get one more question in if we could.
Just be wondering about, is there an overall plan to increase testing? I mean, I know we saw so many spots testing people back in January. Could it be that we aren't really catching a lot of these cases until people really sick because of the fact that there aren't as many testing sites?
Yeah, thanks, Shay, for the question. And I think I'm fine to stay 5 or 10 minutes over, so I'm happy to stick around a little bit longer and make sure people can get their questions answered. Shay, it's a great question. You know, the available testing has increased pretty substantially as the pandemic has gone. It's just changed venues. It's become normalized a little bit. So what has gone away are these big mass testing sites, somewhat replaced by what was the big vaccination sites. But now there's testing available in retail pharmacy locations and increasingly in clinics as well. So there's a lot of testing available. We feel comfortable that we're doing enough testing to be able to recognize increases. And the reason that we feel that way is, number one, we are recognizing an increase, and we're recognizing the increase in cases from testing at the same time that we're seeing it in hospitalizations, which means that we didn't miss a signal there. And two, when you're not doing enough testing, you tend to see your percent positivities go way up, because when you're not doing enough testing, only the people that are sick or symptomatic or really high risk go get tested, and then it artificially inflates your percent positivities. Our percent positivity has increased with our cases going up a little bit, but it's not out of line with what we would expect. So looking at those data points, I feel comfortable that we're doing enough testing, and also that there's ample testing out there for people that need it. One of the other elements here is more cases begets more testing. And what I mean by that is, as cases go up, you know, more people have COVID. Those people have contacts, close contacts. So there's more close contacts out there, and then more reason for people to go get tested, because people that are close contacts want to, rightfully so, go get tested. So we'll see the testing volume go up in the coming weeks as cases go up, because there's just more contacts and more people wanting to get tested. And I feel comfortable we have plenty of testing capacity to meet that demand right now.
Did you have any follow-ups, Shay?
I actually do. Two more questions. Just as far as in schools, what safety protocols are going to change at schools to keep unvaccinated children and staff safe from this Delta variant?
That's another great question. So the Department of Ed put out, and Bessie put out their initial guidance document. It was either earlier this week or last week. That was a document made in conjunction with us as advisors. It's not directly binding on districts. Districts have a lot of autonomy here, but it sets a basic framework. The caveat to that is we are waiting for revised K through 12 guidance from the CDC, and we actually expect that guidance to come very soon, within a week. So that guidance document is going to come out shortly. We'll look at it, we'll review, and then we'll see if anything that the Department of Ed put out needs to be changed or advised. You know, at the end of the day, I'll tell you that the number one thing, everyone wants to have a normal school semester. I mean, that's families want that, teachers want that, everyone wants that. The number one thing that teachers and families can do right now to help enable that is to get vaccinated now. The ability of schools to have a normal fall semester is going to be directly related to what percentage of their teachers and students and their families are vaccinated. If that percentage is low, there's going to continue to be interruptions, absenteeism, need to quarantine students. If that percentage is high, I think they'll be able to minimize that. I do think schools will be able to operate in general in a more normal fashion than they were last year, but we're all interested in minimizing those disruptions and those absenteeism. To get more granular in what type of mitigation measures are going to be recommended, I think we'll kind of hold on that question until we see the new CDC document, which really is going to come out, I think, within days.
Definitely. And just one more, how many vaccine doses are going unused from the federal government's weekly supply? And we were told that we're just using a small fraction of those doses allocated.
It's a lot. I mean, I don't have a raw number, but of all the doses that the federal government makes available to Louisiana, really for the past 1 to 2 months, we've been drawing down from them a very, very small fraction of that. You know, we're drawing down really only what we need. We have a relatively, I should say, small reserve in state that we keep on hand in case there's a surge or a disruption in supply, but it's not that large. So by and large, when 1.8 million people that have at least initiated vaccine, that's more or less what we've drawn down, give or take kind of a rounding error on that. If we need more doses, they're available by the feds, but we don't have a very, very large stockpile in state. We just draw down as we need, but it's a small percentage of what in theory is available to us by the feds.
And would you say that most of the new COVID cases here in Louisiana are the Delta variant cases, right?
Right now, yeah. As of this week, over 50% of new cases are Delta.
Shalina, do you want to go ahead?
Hey, yeah, thank you. I have a few questions, so I'll try to squeeze them into a couple. You talked about the lottery, but I'm wondering, how well would you actually say that's working to get people who are not interested in getting vaccinated? What percentage of the people who have actually signed up for the lottery are newly vaccinated people? And then also, can you talk about kind of like what y'all plan to do next, given the rise in Delta variant cases when it comes to masks and quarantining, since that ship has kind of already left the dock when it comes to opening the state up?
Yeah, for the lottery question, I think it's probably too early to really say, to be conclusive about what effect it's had. We haven't even had the first drawing yet. We saw a 14% increase in new vaccinations in the 2 weeks after we announced the lottery. I think that's substantial. Whether that holds throughout the remainder of the lottery phase, whether it goes up or down, I really don't know. I think we kind of have to wait and see. Of the 600K people who have registered for the lottery, I don't know offhand how many of them are newly vaccinated versus old or previously vaccinated, but the 14% bump during that first couple of weeks was encouraging. But we'll have to just wait and see what the numbers do as we actually have the first round of drawings. One of the reasons that we did 4 successive drawings week after week, again, the first one's next week, is so that we can talk about it and let people know about it and hopefully build up more excitement and hopefully encourage more people to get vaccinated. So I think as those numbers play out, we'll see what they do, and hopefully it proves to be beneficial. The other question is difficult to answer right now. The mitigating measures, typically are not done preemptively. They're typically done when cases go up and there's a real need to do that. So we're not there yet. And the CDC hasn't really gotten there yet either on their recommendations. One of the things that is in our court, in our favor, is over the past couple of months, we did a good job driving transmission down very low. And for example, we got our hospitalized COVID census number down to about 250, which was the lowest it had been since we started counting, over a year ago, so in our first spike. And that gives us a lot of room to go before we would start threatening hospital capacity. So it puts us in a fairly strong position to weather what might be a spike or a surge pretty well. Beyond that, we have to wait and see. The governor has been very strong in this, and if hospital capacity were to be threatened, if mortality and morbidity would be significant, reinstigating mitigation measures are not off the table, but nobody wants to do that. The other way to protect people and avoid against a surge is to increase vaccinations, and that's obviously the preferable way. So we'll have to wait and see what happens, the next couple of weeks with these cases.
Johnston, did you have a question?
Yes, I did. Thanks. And this kind of pertaining maybe a little bit to Baton Rouge, but we've reached out to some local area hospitals. We hadn't checked in for several weeks with them about their staff and employee vaccination rates, and they are still, not where you would think medical facilities would be. Some hovering around right at 50, right under it. How much concern is that for y'all, especially now with seeing the Delta variant on the rise and maybe seeing more hospitalizations, that the staff that they're interacting with, there's a good chunk that also remain unvaccinated with this more contagious variant, the focus?
Yeah, it's a concern of mine. It's a concern both on those staff members' behalf, because they are going to be in contact with more and more COVID patients if these numbers continue to increase. And that puts a risk on their shoulders and a risk on their family's shoulders. And it's a concern of mine for the patients receiving care in the hospital. And when you go into a hospital, you expect to be protected. And it's as simple as that. You are more protected if the nurse, physician, or other care provider assisting you is vaccinated. There's no question about that. I can tell you every hospital in the state is having these conversations right now about how they increase their own vaccination rates amongst their staff. Some hospitals have done better than others. I've spoken with hospitals that have 70 or 75% vaccination coverage amongst their staff. I've spoken with hospitals that have much less. And every hospital is strategizing about how to increase that. We're all, of course, watching the experience of the hospitals across the country that have mandated it. I think you will likely see more hospitals mandate it as time comes. You'll probably see many more do it after the vaccines start receiving full FDA approval, which we think might happen within a couple months. But it's challenging, and I'll add that that's exactly the same for nursing home staff as well.
Let me follow up on that if I can really quick. Are you kind of, and I don't know if you have a ballpark number estimate or percentage wise for the entire state or certain areas, but are you kind of shocked where you're seeing at the percentage of medical employees, hospital staff you're seeing unvaccinated? We're already here in the middle of summer 2021. Are you kind of shocked? Did you expect that number of vaccinated hospital staff to be higher at this point?
I am. I've been shocked and disappointed, particularly with the nursing home staff as well. Nursing home staff, had a front row seat for the very worst of this pandemic. And right now we're at 46% of nursing home staff have initiated or completed 85% of nursing home residents. For nursing home staff, for hospital staff, they bear a lot of risk. They're exposed to COVID, and they bear responsibility for providing safe care to their patients. So I am shocked. I'm anxious to see those numbers go up.
And then finally, on that note, what do you think maybe is driving? I mean, it might be the same as regular people not wanting to get vaccinated, but do you think is driving medical staff who you mentioned or hospital staff who had a front row show to the last 16, 17 months for still, after all these months of having the vaccine available, still not taking it?
In conversations we've had in focus groups, it's been largely the same issues that the general population has, and these myths that are out there that have become pervasive. People that work in the healthcare industry are not immune from those myths. They're all over social media, and it's really hard. And I get it. Look, everything with COVID has been fast and confusing, and I wouldn't fault anyone for not knowing what to believe and what not to believe. It's hard. You do see the vaccination rate go up in physicians nationally. Between 90 and 95% of physicians are vaccinated. That speaks volumes, I think. But for other folks, I think we continue to try and meet people where they're at, honor their questions, honor their concerns, and get good answers, good evidence-based answers to the questions they have. And that goes for whether they're a nurse or a respiratory therapist or an accountant. It's really pretty similar across the board.
Thank you, Dr. Kanter.
Just want to take one more. I know, Shalina, you had a follow-up. Go ahead.
Hey, yeah, thank you for doing this and for going over time. I just had a quick thing. So, some states are, lifting emergency status, and it's concerning, what public health departments are going to be able to do if emergency status goes away. Have you heard anything like that potentially happening in Louisiana, especially like as Delta variant is rising? And then also, the first wave really impacted, people of color a lot in Louisiana and across the South. Some cities like New Orleans still really behind in vaccinating Black residents. Sorry, I know those are two different questions, but if you could speak to both, how do y'all plan to address some of those disparities in this new surge that's coming about?
Yeah, I've not heard much talk about discontinuing the emergency proclamation in Louisiana. The governor renewed it. It was either last week or just prior to that, I can't remember, but it was renewed recently. He typically does it in 30-day increments. It no longer carries strong mitigating measures. I mean, the mask mandate is lifted. Most restrictions on businesses are lifted, but it does, I think, as you allude to, allow the department to be nimble in the response. So it is an important element there. And you're right, the CDC has somewhat sounded the alarm to states that have listed there's emergency proclamations, that they have unintended consequences. They, for example, through our proclamation, we allow all types of care providers to order tests. Pharmacists can order tests, COVID tests, so forth, to expand access. And that's not something that people automatically think about with those emergency proclamations. So it's been important to us. I've not heard any conversations recently that it's going to go away. To the equity question, I think you're spot on. Marginalized communities, Black communities in Louisiana have borne the brunt of this pandemic. I do think this is one of the areas that Louisiana does very well in nationally. When you look at percentages of vaccinations, so 34% of Black Louisianans have initiated the vaccine series, 34.8% of white Louisianans have initiated the vaccine series. I want both of those numbers to go up. Don't get me wrong, but the disparity, the inequity is much less in Louisiana than it is nationally. We tend to do a pretty good job addressing marginalized communities. The model we have of going into communities, partnering with community-based organizations, this is the Bring Back Louisiana campaign, has worked well. And we've been recognized for that by the White House a few times as well. We just need all the numbers, to go up together.
Okay, and with that, thank you everybody so much for joining us and for staying with us. Thank you to Dr. Kanter and to Dr. Lagarde for going a little bit over and addressing some additional questions. If you did have a question that didn't get answered, please reach out to me or to Kevin, and we're happy to get you those answers. And please let us know if this was helpful, because if so, we're happy to do these on a regular basis. Thanks so much and have a good night.